Hello and welcome to Health Live at Seniors Today. We are here on a Saturday evening and today we have Dr. Mukesh Batra, Padma Shri Dr. Mukesh Batra. He needs no introduction. I think I can make it very short, but he's a pioneer of modern homeopathy in India. Dr. Batra received the Padma Shri for his contribution to the field of homeopathy. Today he has 225 clinics across 133 cities, including London and Dubai, and has impacted the lives of over 15 lakh people worldwide. So I have known Dr. Batra for around 25 years now, and I must tell you, he's an amazing person to speak with, as you will come to know today. Prolific speaker, has been writing regular columns in several international and national newspapers and magazines. I remember his television show on Doordarshan and Zee TV in India and Europe. Authored 5 best-selling books on homeopathy in multiple editions and languages. And I must reveal something to you which is not known to everybody, that he's working on his autobiography, which is going to be released on his 70th birthday next year. Dr. Mukesh Batra, it's a pleasure to have you here with us. And welcome to Health Live at Seniors Today.
Thank you, Pradyuman. Thank you very much for giving me this opportunity. And I thank Vikram as well for having created this platform. So I just like to start by saying, that first of all, there's nothing like a senior citizen. Okay. It's whatever is between your 2 years. So it's what's in the mind. All right. And, you're as old as how you feel you are. You're as old as how you behave you are. Having said that, let me say that, with longevity working in the favor of humans in many parts of the world, including India, where lifespans have increased, people are now certainly living longer. But when they're living longer, doesn't necessarily mean that they are living healthier. Our attempt should therefore be to live as long as we can and to die as young as we can. Okay. So in the sense that, when we are coming to the end of our life, we are still fit, we are still mobile, and we are not dependent on anybody. Having said that, let me say that today, 12% of people all over the world are part of senior citizenships. And in the next few years, this percentage is going to increase to 22%. And you have, aging economies like Europe, you have economies like Japan, India still has a kind of a young dividend, where there are young people still. And maybe this is also what I call a silver industry now, but also that 92% of such people have at least one chronic disorder and 77% have at least 2 chronic disorders. So, it becomes very important, therefore, that we start looking after ourselves and our people, not when they are old, but when they are young, And I think if you look at the effect of COVID as well, I mean, why is it that more people are dying in Europe? Because it's an aging population. It's not that they don't have great healthcare systems. Why is it that in India, young people, it's not so bad? The percentage is still very low of mortality. Again, because we have a young race, we have young people, we have a young demographic. So I think, making sure that we are able to take care of, society. And what we don't realize is that the burden that this will cause, not just on individuals and on people, but on society itself, on governments, on people. It's not just the economic burden or the financial burden, but it's also the emotional burden. Taking care of people who are aging is not easy. I have seen in my practice so many young women who haven't got married because they have an old father or mother to take care of who's bedridden. So I think it's very important that we start this conversation in a positive manner of really saying, how is it that we could live long enough and live well?
Very well said, Dr. Batra. I think, you have laid the foundation of this discussion in a very positive manner. And I'm going to ask you a very basic question first. How is homeopathy different from allopathy and Ayurveda? I think that's a question which, a lot of people know what it's all about. And, but still there's a fair amount of ignorance.
So I try to make this as simple as possible. Homeo, similar, allo, opposite. So homeopathy is the study of similars. It is based on a principle called likes cure likes. It was founded by a German MD doctor during his time, almost 250 years ago. Allopathy is the science of opposites. So what does this mean? For example, homeopathy is actually based on the vaccine therapy. Today we are talking about vaccine all over the world. And we are saying, why can't we come out with one? What homeopathy does is exactly that. It puts in a kind of a poison, if I may use that word, or a medicine in your body, which can cause a reaction, a very, 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 very minuscule doses. The body reacts against it and gives rise to antidotes and antibodies, okay, and forms natural antibodies against that problem. So this is how you then build up natural immunity and natural resistance. This is homeopathy. In allopathy, it's the opposite. For example, if you're constipated, you then take a purgative or a laxative. But then what happens is you need increasing doses, because then your peristaltic movement starts slowing down and your body then gets used to the medicine all the time. And it acts in an opposite, with an opposite reaction, and it then becomes even more difficult to pass through. So this is basically the difference between homeopathy, which works on likes, which is like a vaccine therapy, and allopathy, which works on the opposite, which really tries to kill the symptoms, while homeopathy tries to go to the root of the problem. It's also mind and body medicine. Homeopathy is one system of medicine that also recognizes psychosomatic problems. So for example, your backache may be muscular, maybe physical, maybe due to some mechanical problem like a disc problem, but it can also be psychosomatic. It can also come because of some stress that you have. Homeopathy recognizes that. And today, a lot of problems today are psychosomatic. So homeopathy really is the gen next medicine. As far as Ayurveda is concerned, Ayurveda is also natural, like homeopathy, but Ayurveda is made up of raw herbs. While in homeopathy, you kind of potentize them. You take one drop of the herb or the liquid, and you then kind of dilute it. So it's in very, very small doses. So there's a slight difference between the philosophy of Ayurveda and homeopathy as well. While both are natural, but they are different in the action and different in the way they function.
I have a question here from one of the readers of our magazine, who says that, is it possible for homeopathy to cure COVID? That's question one. Question two is that there's a well-known industrialist who was talking about a homeopathy drug for COVID, but as it happened in his own organization, there were COVID patients found, COVID positive patients found. So, is it really all for real, or it's just a matter to talk about?
Okay, so let me first try to explain to you what is the history of homeopathy in epidemics, and let me explain to you what is the philosophy or treatment of how homeopathy works in an epidemic. And then I'll come up to the actual points of what you asked, the question, because I think from there you'll get the right answer. So first of all, let me tell you that the use of homeopathy in epidemics goes back more than 150 years. Every big epidemic that we've had in the past, homeopathy has a very good track record of successfully treating. Let me give an example of Spanish flu. That's what we're all talking about, which happened 100 years ago. Okay, the mortality rate with medicine at that time, and of course that was very old and there were different methods of treatment, but was 30%, which means 30% of people who had Spanish flu died when they were under allopathic medication. The mortality rate for homeopathy was only 1.05%. So this is just one example I'm giving you of how homeopathy is effective. Okay. Similarly, the Cuban government, okay, in 2000 used a homeopathic medicine for leptospirosis, and they found that it was very, very effective. The Andhra Pradesh government used it for Japanese encephalitis. And now, of course, the Indian government is recommending for COVID a medicine called arsenic, which has been researched by Ayush Ministry, and they've asked people to take it. I'll come to that a little later. This is one part. The second part is you need to understand that there are two sides of an equation whenever there's any infection. On one side, you have the virus or the bacteria, whatever is the invading part. And the other is the body itself. So one is the resistance of the body, and the other is the strength of the virus. Now, if the virus is very strong, no matter what you do, you are still going to fall sick. But you will not fall sick as severely. It will not give you so many symptoms. So let's understand that. Why is it that we are not able to get something against COVID and allopathy? Because allopathy has got very good medicines against bacteria. They can kill bacteria with antibiotics, but antibiotics don't work on viruses. So this is the problem. On the other hand, the philosophy of homeopathy works by building either general immunity or specific immunity against the virus. Now, I remember that when in my pathology days as a college student, medical student, many, many years ago, we must know that there are more than 1 million bacteria or viruses in our body. And a lot of them are actually good for health. You know, they give you good gut health. It's not good, gut health, you know. So it's not necessary that every virus or every bacteria is harmful. That's a wrong thing. A lot of them are actually helpful to the human body. So you don't want to kill them unnecessarily. And I remember my pathology professor saying that, you know, if you have worm infestation, the best thing that you should do to keep the worm quiet is eat an extra chapati for the worm. So, you know, just keep it calm and it's not going to harm you at all. So there's something called symbiotic, you know, arrangement that we have with the environment, that we have with our body, that we have with the bacteria and the flora and fauna within our body. Okay. It's not good to disturb it. On the other hand, what homeopathy does is it tries to build immunity. Now, if you build immunity, okay, you know that there are 10 people who are going out for a party and one of them has got a cold. It's not necessary that all 9 will fall sick with cold. Only the one person who has a weak immunity will then get a cold. The same thing happens with COVID. The same thing happens with any other infection. So the way therefore to treat it really is in 2 ways. Number one is you can take a specific, you know, prevention, which for this particular epidemic, it is arsenic alb 30, which is what the government has recommended. The Ayush Ministry has recommended. They have given 3.5 crore doses, which is to almost 50% of the population in Ahmedabad, in Gujarat. And we have donated through our foundation, Dr. Batra's foundation, almost 1 crore doses to people, including the entire Maharashtra police force, including containment zones in Mumbai, and including some of the villages in Goa. So this is something that has been recommended by the government, something that really works. And there is a certain amount of research that has already been done, but more clinical trials are still underway. So this is one part of it. Now, whether it can be treated to cure or treat COVID, I cannot say. That's a matter still of time, of experimentation, of more research being done. But certainly as far as prevention is concerned, and as far as, you know, asymptomatic and early symptom cases, you know, minor symptom cases are concerned, homeopathy is very effective. And this medicine, arsenic alb, works very well for that. So that is my answer to this question. The second part of asking...
Ask you this question. So arsenic alb 30
yes,
is to be had how many times a day? And
so it is 5 pills, 1 every day for 3 consecutive days. 3 consecutive days, once a month. And then you repeat it after a month. So it is just a 3-dose, you know, regimen. Arsenic alb 30, morning, day 1, morning, day 2, morning, day 3. Half an hour before and after, don't eat or drink anything. That's it. Okay. And after 1 month, you repeat it again the same way.
And you can have coffee when you're having this?
Oh, you can have whatever you want, as long as you don't eat or drink anything half an hour before and after. So this, now coming to the other part of the question, let me just finish that part because I don't want it to remain unanswered. Is the industrialist in question is a very dear friend of mine. Okay. He's a very, very great person who believes in homeopathy very passionately. Okay. And it is with the best of intention. He recommended some medicine which he found another homeopath using successfully in some cases. And that is what he has used. But I can tell you that from whatever the government has recommended, the arsenic alb, not any other homeopathic medicine, has actually worked very well. So, you know, I think it was done. And like also I told you that, you know, if you don't follow societal distancing, if you don't follow hygiene, if you're working in a very closed atmosphere, no matter what you do, you're still going to get it. It's just that it may not be that strong.
We have a question from Anil Agarwal who asks, can we give arsenic to children? Yes, you can. It's a safe remedy. It can be given to all age groups. You can give it to your grandparents. You can give it to your grandchildren. You can give it to anybody. You can give it to children in drop form because not in pills. They may find it if they are like below 6 months. You can give them in drops, a few drops in little water, and they'll be very happy to take it. I'm saying you can also give it to your pets. My lab, you know, loves to eat homeopathic medicine from my hand because it's sweet and lovely. I'm saying, you know, kids call us candy doctors. I'm saying you'll remember that from your earlier days when you used to go to homeopath. You know, it's human medicine. It causes you no trauma. It causes you no harm.
and it helps you in a very, very painless manner to kind of get all right. So yes, I think all age groups can take it.
So we have a question from Jagdish Patnavis, who says, most of senior citizens are suffering from prostrate. Please advise suitably as to how to combat the same.
So, that is a good question. And yes, I would say that, prostate enlargement is one of the commonest problems of senior citizens who are males, because, prostate is a male gland. I mean, women don't have prostates. It's only the males who have it. So what happens is the common condition there is called BPH, which is called benign prostatic hypertrophy, which means that the prostatic gland, which is a small gland, becomes a little swollen. When it becomes swollen, it is just on the bladder, and then it presses on the bladder. Therefore, you're not able to pass urine freely, and you get something which is called a post-void urination residue. So it kind of lies over there. Because of that, you get infection because you're not able to pass all the urine at one time. So commonest symptoms of this are going to the toilet frequently, getting up in the night, passing urination drop by drop, not very freely. There are some homeopathic medicines. Research has been done on it. One of them is Sebal Cerulita, which is a homeopathic medicine which has been clinically proven to help to reduce enlarged prostate. But I would recommend that, this is also one of the, reasons for cancer in males. So you must always do a PSA, do a blood test, which will kind of tell you whether if your PSA is under control, you know that you don't have cancer, you're not likely to have cancer, and therefore you are safe. And as far as just the, benign inflammation is concerned, you can actually treat it with homeopathy.
We have a question from Rajpal Singh, who asks, sir, is there a cure for eczema in homeopathy?
So yes, there is a cure, and I'm saying, this is not really the forum to answer personal questions. Let me just make it very clear, because like I said in the beginning, homeopathy is a very personalized and a treatment, and you actually need to go through an entire 1 hour, 2 hour case history, identify what will work for you, and so on and so forth. So you really need to go to a qualified homeopath, spend enough time for any chronic ailment. For acute ailments, common ailments, yes, it's okay. You can prescribe and you can even self-treat yourself. But for anything which is chronic and lasts for a long time, you need professional help. So eczema, just to let you know, that is just a common name. Very often it is a type of dermatitis, and there are different types. It can be allergic, it can be contact. You can get it wherever your watch strap is. You can get it where you're wearing your chappals. So you can get it with contact as well. And a lot of the time, it's also neurodermatitis, which means that it's also related with stress. So please remember that eczema, there are two things to remember. Number one is that it is very often psychosomatic. So if you have stress, unless you treat your stress or your anxiety level, your eczema will not disappear, no matter what you do. Number two is that to treat eczema, you need to treat holistically. You cannot just it doesn't go away by just applying ointments locally, because there is something else that is wrong with the body, and the body is kind of throwing out toxins, and you are then suppressing it by a local ointment. So it'll get better for some time. The moment you stop applying, it'll again come up. So you have to be a little careful about this, and which is why you need proper professional treatment.
We have a question, since you spoke about anxiety and stress. We have a question from somebody who says, I'm 74-year-old and I haven't stepped out of the house since March. I really want to go for walks and I'm scared to do so. What will help me ease anxiety? Please advise.
So the first thing is free your mind. Okay. I am also locked in my house for 5 months, and I also haven't stepped out, but I make sure that I walk 10,000 steps every day in my house here. And if I was to go out, I'm happy to go out. So I'm saying, as long as you take precautions, don't be worried. Like I said, it's really not the killer that, you think it is. You have to be cautious. You have to be careful. You make sure that you're doing social distancing. You make sure that you wear a mask when you go out. Okay. And you're actually not so exposed as long as you're in open air. So as long as you're, in the free places, you can walk freely, but you're not bumping into people. You're not standing by and talking. You're not going for a stroll. You can easily do it. Number two is, like I said, anxiety comes from the mind. Okay, it comes from looking at bad news, reading, news items which every day tell you how many people are dying. The fear of death, anxiety for that. I think sometimes a little bit of it is natural, but there are homeopathic medicines like, for example, Kali Phos, taken in 6x potency, which are kind of a nerve calmer. So they will actually help you to calm your nerves and not to feel so anxious. So I would say that you can take Kali Phos 6x and you can take all the precautions, and you can certainly step out of your house. And it's like a test. So once you get out and you're confident, then you will be more confident of carrying it on. Your fear will go away. As they say, I mean, may I just say this here, Pradyuman, in lighter note, they say, दादर के आगे सीट है और डर के आगे जीत है. Correct? For all frequent travelers in Mumbai suburban, they know that, we say दादर के आगे सीट है और डर के आगे जीत है. So, you have to just get rid of fear in your mind. It's a state of mind. Once you get it, once you walked out and you're safe and you're happy, you'll continue doing it regularly with all the precautions.
Right. We have a question from Bridge. It's a short but a funny question, but very important one. How do you find a reliable homeopath in a town?
Okay, it's a difficult one to answer because ultimately there's a lot that depends on finding the right doctor, whether it's a homeopath or any other doctor. Because a lot of it has to do with the comfort level. A lot of it has to do with the trust that the doctor is able to create. A lot of it has to do with the professional efficiency that the doctor has, and also in some way the experience that he or she has. So I think there are many factors. The fundamental factor, all I'd say, is that now education across India at least is standardized. And therefore, every doctor homeopath that you consult today has done a 5.5-year course in medicine, surgery, gynec, and homeopathic subjects, and has done certain amount of clinical practice in hospitals and in clinics and in OPDs. So whoever is a qualified doctor who has done a proper course is the doctor that you can go to. Then after that, I'm saying then a lot of other things depend on convenience, depends on the confidence that you have, the trust, the reputation of the doctor, how many cases he has cured, how good is he in his work. A lot of other things come as well. But I think you can be assured that you're not going to a quack when you're going to a doctor who's done 5.5 years. Please understand this. It's now almost a 10-year course to qualify as a doctor. It's 5.5 years in basic medicine, which means that you get that BHMS, graduate. You then do 3 years in MD, where you can do MD in psychiatry or MD in pediatrics, like an advanced course, post-graduation course. That's another 3 years. And then we have the Dr Batra's Academy with Mumbai University Health Sciences, like a public-private partnership, which is a 1-year course in dermatology. So once you've done all these years, you then do 1 year of dermatology as well. So it's almost a 10-year educational course by the time you really qualify to practice as a successful homeopath. So there's a lot of effort going there, lots of education going there. And I think therefore, if you go to a qualified homeopath, you're going to the right person.
But you do have your internships in hospitals, you do
yes,
that opening of the body and those kind of things. So
yes.
how different is it from an MBBS program?
So it's not very different, which is why this whole thing of the government trying to take it as part of an integrated course. So everything is the fundamentals are the same: anatomy, physiology, surgery, gynec, jurisprudence, all of that. What is different is the practice of medicine. So while they teach pharmacopoeia, over here we learn materia medica, we learn repertory, we learn homeopathic subjects, we learn homeopathic drugs, we learn the use of homeopathic medicines and how to use them, and homeopathic philosophy on how it works. There you deal with chemical drugs. That's the difference.
We have a question from Dinesh Parekh, who says, I have always have a throat problem, continuous cough and obstructing a clear voice. Is there an advice for somebody with a throat problem with continuous cough?
Again, very difficult to say this without really seeing a patient. I mean, there are many reasons for a persistent cough. But one of the reasons, of course, is use of voice. So the first thing that you can do is not use your voice too much. Try to take voice rest and don't shout. Okay, so every time you strain your vocal cords, your voice will become hoarse, you will get a cough. So that is one thing. Second thing, what you can do is you can just take a little warm water with salt and haldi, and you can gargle with it. I'm sure that you will feel much better. Homeopathically, there are many medicines, but then you'll have to go to homeopath to get advice.
In today's lifestyle and food habits, can homeopathy help in supplementing basic nutrients to the body to keep it healthy always?
Yes. So the answer to that is yes. First of all, that there is a kind of a division of homeopathy called biochemistry. Biochemistry has salts, and that it believes that if your body is deficient of some salt, you can replace it by taking it. So that is really like the vitamin theory. So you have also homeopathic vitamins, if I may say so. So you can use them, okay, and they are very effective. So you can actually build your minerals in your body by replacing them with biochemic products, and that does take care of a lot of problems as well. Like I said, that if you take constitutional proper homeopathic medicine to build your resistance, then you're strong, and then you don't fall prey to common ailments.
So, what is the equivalent of vitamin C or vitamin B in biochem or homeopathy?
So, there's no equivalent because it's a different theory altogether. Okay, so you can't replace vitamin C but like for example, in old people or older group, one of the biggest challenges is really, for example, not just vitamin C, but a lack of vitamin D. Now, even though we live in sunshine country where there's so much of sun, but our absorption of vitamin D is very poor. And that is why lots of Indians have actually vitamin D deficiency. Now, when you have a vitamin D deficiency, then you actually get osteoporosis as you grow older as well, more chances. So, which is why, you get, every 15 seconds, there's one older person who's falling down. And every half an hour, there's one older person who's dying of injury from the fall. So what homeopathy does is, there is no substitute for vitamin D, but you can take homeopathic medicines, which will help you to help in the absorption of vitamin D. Because what is happening is you can take vitamin D, but are you absorbing it in your body correctly? So to set that balance right, you need to take some constitutional homeopathic medicine, which will help you.
We have a question. I know it's a very specific question once again, but what medicines should be taken for cure of asthma, COPD and sinusitis in homeopathy for senior citizens?
Okay, now, all these are three different disorders, but the person can be the same. So
Right.
Really the answer really is that, you got to treat the person, not the disease. And when you go to treat the person, they need to understand that there are different reasons for all of this. Let me just only talk about asthma. So, lots of the time we believe that asthma is a physical problem. But again, asthma is also psychosomatic. It comes with anxiety, it comes with stress. And it's a catch-22 situation, because when you are sick, then you become anxious. When you're anxious, then you fall sick again. So you can only break the cycle by actually again taking proper constitutional medicine, which will help you to build up your immunity. And what you will notice is, you'll notice that over a period of time, I'm not talking about immediately weeks, but over months, you will then find that your frequency and intensity of the asthmatic attacks and your coughing attacks are actually falling down, and they're becoming less and less. And your dependence on the medicine that you're taking, your inhalers, will actually start going down over a period of time. And this is how you know that you're getting better. And after some time, you can actually get rid of it, and you can lead a completely free life with proper breathing. As far as sinusitis is concerned, yes, it can be treated through homeopathy. As far as COPD is concerned, it's actually a chronic problem. It gets worse with age. So as you're growing older, it actually becomes worse. So you can't really cure it. You can't treat it. It cannot be reversed, but you can manage it. So you can just keep it at that level.
Thank you. We have a question from Jagdish Mahapatra, who asks, can diabetes be cured by homeopathic medicines?
So again, I would say yes and no. First of all, diabetes is a lifestyle problem, as you all know. And, India is now, very soon going to become the diabetic capital of the world. And it's 4 times more in old age. So yes, you have to be a little careful. So therefore, I would say number 1 is lifestyle changes. The way you eat, the way you walk, if you move, do some exercise, if you're not so stressed out, okay, if you have regular habits, chances are that your sugar will come under control. That's point number 1. Number 2 is, if you're insulin dependent, then there's very little chance that homeopathy will help you. If you're talking about type 2 diabetes, which is non-insulin dependent diabetes, then a research has been done in Athens, which actually shows that when the control of blood sugar was 47% with oral anti-diabetic medicine, when homeopathy was added to it, together to the allopathic medicine, the control was 97%. So you can actually use homeopathy in conjunction with allopathy if you're a diabetic, if you're a non-insulin dependent diabetic. And over a period of time, it can help you. That, together with lifestyle changes, will certainly help you to keep your sugar under control.
Is the sugar in homeopathic medicines okay for a diabetic?
Okay, good question. Whether homeopathic medicines that you take, is actually cane sugar. They are very, very small, and they normally don't affect a diabetic. You can also take it, like I said, in drops, which are based of alcohol. Again, it's just one drop. Again, it's too minuscule to affect it. But if you're so particular, or you're brittle diabetes, where you're worried about sugar going up and down, then you can also get homeopathic medicine in water, and that there are certain, pharmacies which actually make that, which is special for diabetics. So then you have no problem of any sugar intake at all, or upsetting your sugar level when you're on homeopathic medicine.
We have a question from Katie Dadanchi, who asks, is there a tablet we can take in place of shell cal, since shell cal causes kidney stones, can cause kidney stones?
Yeah, so there are, so there is homeopathic calcium as well. One of the commonest is calcarea phos, which is a calcium and phosphorus, small doses, 6x. That is very good as a calcium replacement in homeopathy. We also give it to a lot of children for easy dentition, and it's easily available. So yes, you can substitute it with the homeopathic calcium.
We have a question from Jagdish Mahapatra, who asks, what is a homeopathic painkiller? Is there an alternative? Not that his question, but I'm asking, is there a alternative for a combiflam, for instance?
So first of all, one should not look for painkillers at all. Okay, they are the most harmful things that one can do, but somehow one wants to manage pain, so one may take them. But a lot of people self-prescribe it. And a recent research last week was just done in UK, and they said that people who are taking painkillers don't even know the difference between an anti-inflammatory and a paracetamol. So, and all of this harms your kidney. Ultimately, people who are on long-term painkillers actually get renal failure, or they are more prone for the kidneys to fail. So the use of painkillers is something that I don't recommend at all, number one. Number two is, let us understand that pain is a symptom. And therefore, if you're getting pain, then there's something wrong with your body. So if you're getting a headache, for example, then it could be anything. I'm saying you can even have a brain tumor. So if you keep popping in painkillers, you will never get to the root of the problem, because you are just, masking it. So I think you should be very careful about taking painkillers. Having said that, if you want to take a homeopathy safe medicine, MAGFOS is a medicine. It's an antispasmodic medicine. So it works for kind of pain spasms, or, spasms which come with pain, like, abdominal cramps or cramps in the body, and somewhere even as mild painkiller. But if you've got severe pain, then it may not help you. Again, I'm saying other medicines like Rustox or Arnica or Brineum may help. So for that, you need to really physically visit a doctor who can then help you.
There's a question from Bridge, who asks, is online consultation possible?
Yes, I'm saying that's a very interesting question, because especially during COVID times, when COVID first started, we actually first had awe and shock, like most companies have. And then because we are 24/7 networked and we use IT very strongly in our companies, all our 225 clinics all over the world are 24/7 networked, and all case histories are on computers, so it can be accessed anytime. The first thing that we did was we managed to put our computer systems and software into 100 doctors' homes. And then from there, they could actually consult. Today, of course, even from the clinics, today almost all the clinics are open regularly. But even from the clinics, e-consults are done regularly. I'm saying it's today become a very easy and convenient form of consultation. Sometimes it is necessary that you need to see the patient and examine the patient. A lot of the times it is not necessary. So depending on what is the problem, you can always have an e-consult to start with. And then if you need to visit a doctor, you can visit a doctor later on. But e-consultation is here to stay. The number of e-consults all over the world is increasing. And I still believe that even once people start moving out, I think a certain percentage of people will still e-consult. And it is possible to get any consultation from a doctor, which is effective and useful.
I think we have time for 3 more questions, Doctor, if you don't mind. There's a question from Sri Gopal Pachisia, who's asked a question twice over, so I'll ask his question. Is there a solution for burping and acidity, and a dramatically different ailment also that he's talking about is back pain and calf pain?
So back pain and calf pain, again, I already addressed it many times, that any kind of pain you should not ignore. because a backache can be slip disc, it can be so many other things. So you need to really go to a doctor and check. If you want some temporary relief, then medicine like Macfos 6x, Rustox 230 can be taken for the time being. Okay, that can help you to just reduce pain. This is one part of your question. The earlier question was burping and acidity. So really a lot of this depends on what you eat and whether you're eating the right time, whether you're having water with your meals because then you're diluting the acid, whether you're sleeping immediately after eating because you need to walk a little bit after your dinner and not just go to bed. Having said that, simple homeopathic medicine like Natrum Phos 6x and Nux Vomica 30 will help you to actually reduce your acidity level and your burping.
We have a question about this Bach flower remedies. They are part of homeopathy treatment. Could you tell us a little more? This is a question from Jagdish Fadnavis.
Okay, so Bach flower remedies are again like a division of homeopathy, which was discovered by a doctor called Bach, who was a follower of homeopathy. And these are kind of flower remedies. So these are made from flowers, and a lot of them are actually useful for moods, emotional. A lot of them are emotional medicine. So, they are very useful for people who get angry easily, people who are emotional, people who get depressed. So for all these Bach flower remedies, which is like a subset of homeopathy, are very useful.
Two more questions. Are Indian medicines as good as imported? A question from Saranjit Singh.
So today, a lot of Indian medicines have collaboration with foreign companies, and they are not bad. But there are two parts to any kind of product. One is the sourcing. So that a lot of homeopathic products first came from Germany, and then once after the World War, when the autobahns were built, which are the highways, there was a lot of carbon monoxide and lead poisoning found in the plants, and ultimately all those old companies which were once very reputed of homeopathic products had to shut down. So the source is very important, which is why if your plants are grown in the Himalayas or in the Alps or in the Austrian Alps or in France where there's open meadows, no pollution, I'm saying that is where you get the correct source. That's one. The second thing that is important is of course the technique and the process. So if your process is good, well programmed, there are no nothing that is no contamination that comes in the whole process. So all these processes and the raw material sourcing is far better from abroad, which is why then those products are really more efficient as far as Indian products. But Indian products also are not bad. I'm not saying that they are bad, but I'm saying they can improve, and they are improving. But because of the raw material use and because of the processes of making sure that there's no contamination.
I think we have time for just one more question. Doctor, is there a cure for depression and mental health issues in homeopathy?
So that's a very burning question. Mental health today has become a big issue. And especially during the lockdown, the percentage of mental health patients actually increased. An estimate has been done where 7% of all elderly people suffer from depression, and 18% of all suicides happen in elderly people. So I think it's a very serious problem. And I think it's very important first that people recognize it and then actually take help. Homeopathy has very, very good medicines for depression and for anxiety. It's good that you talk to your homeopath, that you consult, and you try to get yourself treated. It is possible. There's very good treatment. And I would really recommend that, talking to somebody is very important, and talking to a professional is very important. So do talk to a homeopath. And there are medicines like Ignitia from, death from, recent loss of loved ones and, feeling depressed after that, or from old, hurts that have happened in the past, breakups. Natramure medicine prepared from salt is very good. So there are many medicines like this which are useful for depression. And I would really say that mental health is a very, very big thing, and it very often goes unnoticed. So certainly, I think we should make sure that we take note of it and that we actually take help. Now that you've spoken to me about mental depression, and I started the conversation with talking about age and saying that, it's something which is in the mind and something between the 2 years and how you feel. Age is a state of mind and nothing else. I'd also like to end our conversation by actually, saying that there was a lot of research that has been done in Harvard, and one of their largest courses has been a course on happiness. And one of the things that they found over there was, over so many years of studies, over so many families, that what really makes people happy are people who have proper relationships. So I think one thing that is very important in old age and for senior citizens is to keep relationships going. If you have these relationships, whether it's with your children, your grandchildren, whether it's with your pet, you are going to be happy, and you're not going to be lonely. You're not going to be alone. That's one point that I'd like to make. The second thing, of course, is that life is actually about giving, and the more you share, the more you live life. And especially at the end of your life, at the end of your, you lived so many years and you've been happy, why not share that happiness with others? My, mother used to recite this small little poem, which I'd like to repeat over here. She said, life is an echo, all comes back. Life is an echo, all comes back. The good, the false, the true. So give the world the best you have, and the best will come back to you. In giving, there is receiving. And therefore, all of us who are associated with some kind of charity, some kind of Rotary Club, some kind of sanstha or institution, where we are looking after people who are less fortunate than us, we are going to make sure that in doing so, not only are we helping them, but we are actually helping ourselves. I'd like to, agar आपकी इजाजत हो तो मैं 2 लाइनें गुनगुना देता हूँ.
Of course, and
that's a philosophy.
Say that Dr. Batra is a very good singer, and if I'm right, you have a show every year for
an old age home. For an old age home, yes.
Great thought. So yes, of course, you must.
I don't have my orchestra, but I just like to, end. किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, जीना इसी का नाम है, जीना इसी का नाम है, जीना इसी का नाम है, ला 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 La 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 la.
Thank you very much. Thank you very much, Dr. Batra. It was a pleasure having you here. You've answered as many questions as possible. I know there are some questions which have come in even as we speak. So I'm sorry we've not been able to answer all the questions, but I'm going to perhaps send you some of these questions, and
sure,
if your office could help with the responses to these, it would be great. Thank you very much for your time. I know you are an extremely busy doctor. I know getting an appointment from you, whether it was 25 years back or it is now, is impossible. So our readers here are privileged to have an interface with you. Thank you very much.
Thank you very much, and thank you to everybody for joining in. Thank you.